Welcome back to WBRZ News 2 at 4. Dr. Z is here today, and we've talked about laser treatment before, and we're going to be talking about it more today.
Yes, for
concentrating.
Scars. Yeah, for scars.
Okay.
You know, I had a lot of questions after we talked about it last week or the other week, and there are many types of scars, and so patients had. So the different types of scars, you can have scars from acne, you can have it from surgery, from trauma, accidents, car wrecks, you were working in the yard, all different types of scars. And the old adage was, and what doctors were taught, was that you wait 6 months. Well, that's not the case. Now, with the new knowledge we have, the sooner the better. So instead of 6 months, 6 weeks or sooner. And so the sooner we can get to it, the better. We can usually treat scars of any age, but if you happen to get a scar, come in earlier. And then the other thing that happens with scars is sometimes they start itching and they will make more collagen. Your body is really good at fixing itself. So if you get an injury, it wants to fix it. Well, sometimes it continues to fix it way past the point of being fixed.
Okay.
And the scars tend to get heaped up or
raised above the skin.
Yes.
I've seen that.
And they can be red and they can itch tremendously at night, especially when you lay down to go to sleep. And I've seen patients recently. I had a little girl and she has a long scar on her arm that I'm treating, and she would scratch it on to the point of an ulcer, you know, taking the skin surface off. And after one simple steroid injection, which may be the first treatment for that type of scar, it's a game plan. She was so happy. The redness went away. She could sleep at night. It really does change a lot of things. And that was in preparation for using one of the lasers that I have at my office. And usually, so you can do chemical peels, you can do lasers, you can do what we talked about, a steroid injection to help with the itching and help flatten it out. We also have something called subcision. Now, subcision is normally the skin is flat, the surface is flat. Well, sometimes, especially with acne scarring, the skin is tethered down, if you will, by scars. Well, I can go in and we can cut that tethering so it releases the scar. So that's an option. There are many types of options. We also have pictures here. And
I wanted to take a look at those pictures.
To see. Okay, so this is a young woman, very, very young, who had a skin cancer on her forehead. And so the dermatologist referred her to me early on in the scarring process, actually after the second week. And then you can see the bottom left, and then now you can.
That is amazing.
It is. It really is amazing. And I think she only had 2 treatments, and that's with a fractionated laser. And that scar probably total was $300 to treat. So it runs, depending on what you're using, peels versus laser, from $75 to $500. So it really doesn't have to be that much. You just have to know what is out there, what's available. See a specialist and get other opinions, because some doctors don't know what is available.
Okay.
And that's why I wanted to share with you some of the, and all skin types. It doesn't matter. From the lightest skin to the darkest skin, we have options.
Thanks, Dr. Z. We appreciate you
Thanks
coming
for
in
having
today.
me, Brittany.
You're watching WBRZ News 2 at 4. We'll be right back.